in Paris. I have been working in the health care and wellness for about 12 years. I have to tell you a little bit about me first, because I have a strange history, a strange background. I did not think I was going to end up here because I have a Bachelor of Commerce. Actually, it's not from here, so I don't want to even reveal where I studied.
Well, that's a good
McGill.
Well, that's a good place to start if you're going to be.
That's a good place to start because it actually taught me a lot of things.
Exactly.
I have a Bachelor in Linguistics, so I also studied in Europe. I studied in Barcelona. I did my linguistics degree in French, Spanish, and English in Universidad de Sadi in Barcelona, and I also started exercise science, but something else took my attention, and I ended up in osteopathy. So I'm now doing my PhD degree in osteopathy. So I'm an osteopath as well. So I have an interesting position to be in, and it's a very nice position because I also have a military background. So I did a lot of things. I never stopped. I just kept one thing after the other, and I was finding myself. And I guess it leads me to where I am today. It's a real interesting position because I'm sort of a really disciplined person. I'm a great athlete, martial arts, I was track and field, I ran track and field for the military, I have a 4th degree black belt, I'm world champion, I can go on forever with the accolades that I have, but that's not what I'm here for. I'm here to tell you that I have acquired some skills over the years that has made me a professional today in what I do, and I now understand all the things that I've done and how it helps me in the healthcare industry, because I wear several hats. In the morning I start at 6 o'clock every day. I have clients, so I personally train clients from 6 to about 1 o'clock. I take a break in the afternoon, and from about 4 or 3, whatever my days are today, till about 9 o'clock generally, I have patients, and I treat them osteopathically. So, what I'd like to speak to you today is about the professionalism that I require to perform on my daily basis. And the fields that you are going to go in, regardless if you're going into professional healthcare or any profession, I think what I have to say is actually quite interesting, because it took me a lot of disciplines to figure it out. I made monumental mistakes. And besides teaching you today, because we're in university, we're pretty smart people, I would like to tell you about my mistakes first, and then tell you about the good stuff. Now, some of them are a little embarrassing. I'm not going to lie, but, you know, we're cool. You know, I'm going to tell you one of my biggest mistakes. So, 12 years ago, I started my little company. I made this little slogan while I was in that gentleman's class. I'm going to point him out because he's my professor. He started me in this field. I love him and I hate him at the same time. What happened? I started, and he told me, I'm blaming him, he said, when you're done this course, you can go out and you can train any professional, because you are a professional athlete, you know what it's about, but now I've given you the skills to go and train people. And I said, okay. But he didn't tell me how to do it, you know? And so I went out there and I tried my best. One of my first clients walks in the door. I'm ready. She goes, okay, I'd like to lose some weight. And I say to her, but how are you going to lose weight when you're pregnant? I know, you know where this is going, don't you? She wasn't pregnant. But I swear to you, listen to me, I'm not joking, I'm serious. She had only a stomach on her. You should have seen her. It was like this. And I said to myself, she's got to be pregnant. And she looked at me. We're friends today, that's why I can now talk about the story. Because this is 12 years ago. She was like one of the first people that walked into my office. And she said, excuse me? And I'm gonna add to it because she was a black lady, right? And she gave the, excuse me? And I went, I'm sorry, you want to bring your stomach down? And, you know, and she said, I said, you're not pregnant, why would you want to bring your stomach down? She said, I'm not pregnant. And I really thought she was joking. So I continued and I said, no, you're absolutely pregnant. I mean, come on. And it was like this. All right, I'm going to pass that story because the next one gets even better. Now, don't judge me, all right? Because I made mistakes, and these are mistakes anyone and everyone can make. Not as monumental as I make them, mind you. So, this is a Saturday night. I'm a real go-getter. I want to build my business. I'm sitting in my office, and this obese woman walks in. It's clear. She's about 280 pounds. She's 5'2" or so. I have an intake, a consultation with her. I'm talking. This is Saturday afternoon, 4 o'clock. We're together for about an hour. I used to do my marketing. I found out that on Saturdays, after shopping, people decide they want to drop by the gym. Maybe it's guilt from the amount of food they just bought or whatever. I never figured out the answer, but this is what was happening to me. So I said, all right. Sitting at my desk, and I could see the door, so I'm the keener of every other trainer in the gym. I see her walk in. It's obvious. This is my next client. So she comes in, we do our thing. She says, oh, excellent. I really enjoyed the conversation. When can we start? I said, we can start Monday. I've got the whole thing going down 3 times a week, and we're good to go. She's about to leave. She stops at the door. She says, can you do my body fat, my BMI? And I said, you know what? Why don't we wait till Monday? She goes, oh, okay. So she walks away. She stops at the door. She comes back. She goes, I'd really like if I can, go home with an idea of my body fat percent. And of course, I'm thinking, wait a minute, no, let's wait till Monday, we'll start Monday, because I am a professional and I'm thinking this through. I'm a professional healthcare provider, and I obviously know she's obese, and I don't want to tell her, and I've already learned my lesson from the pregnant lady. So I'm saying this is not going to happen again. So I said, listen, I really like if we can wait, because I have to get the caliper out and do the whole thing. She walks out, she stops again. I said, oh no, this is it. She turns around and she says to me, it's because I'm fat. So I'm trying to be professional. I said, yes. I'm being honest. So she said, so that's why. I don't think that's right, because I'm fat. And I said, okay, listen, it's not that you're fat, you're obese. And my caliper cannot go into the fat pinch that I'm going to do.
Oh, you said that?
What's that?
You said that?
Straight up.
Oh, geez.
When you get to know me, you'll find out I am the straightest talker there. I'm telling you like it is. I've learned professionalism. Unfortunately, I tell the blatant truth. Sometimes, we'll discuss it in a few when we talk about the attributes that we want to have, but one of those things, military, martial arts, I'm sort of a straight arrow guy. I tell it to you if you like it or not. You ask me the question, you're going to get the answer. So, I tell her, you're grossly obese. She storms out. I'm all depressed. I just lost this great client 3 times a week. I know I'm for sure 6 months with her. 20 minutes later, I'm sitting at my desk again. I see this huge man walking in.
No, no.
Now, I'll figure this out right away. I'm a smart guy. You in Paris? I am. You just finished talking to my wife? I did. But I'm not a fearful guy, I can defend myself. I'm not really afraid, but he's trying to intimidate me. And I look up at him and he said, what's that all about? I said, well, your wife is obese. He says back, I said, and in fact, so are you, sir. And I think you need to do something about it, or you're going to put your health in jeopardy. So, long story short, I trained them both for a year. In the first year, they lost 100 pounds each. They were my first 100-pound lost clients. No drugs, no medication, just plain diet, just plain training hard, regular mental exercise about their health and where they wanted to be in life. And that's a true story. And I tell you these stories and these things because that's how I became a professional. It wasn't because school taught me how to be a professional. Most of it came from experience, but there's only so much I was able to learn from school. The military taught me a lot of things. Martial arts taught me a lot of things because these were about me and my personal boundaries and the settings and the environment that I had to create. Today, I function as an osteopath. And this is a whole different paradigm. This is a whole different set of rules. Because now I have people that come into my clinic and they're in bras and underwear, they're in boxers, and today I did a lymphatic on a elderly lady who lost her breast, and we had a phone conversation at the beginning of the week, and she cannot be touched for other reasons. She had some trauma in her young life, and she's never been touched by a man. So we had a little phone conversation. She came in today, and I was expecting it, so I left a little bit more time, and I told her, you realize that I cannot do what I need to do unless your shirt is removed. And she said, okay. We did a little more conversation, her intake, the history, and in the end, her shirt came off, she was on my table, and I treated her. She left there fantastic. I'm seeing her again on Saturday. So we got movement. When she got off of the table, her hand was moving, the flow, the lymph, well, we will get to that. And to your question about fascia, it was quite interesting because that's a huge treatment process for me. So she was restricted with a lot of fascia in her upper cervical, led down into her shoulder. And as we all know, in osteopathy, we believe that we treat the whole body. It's not one specific part. So as we started in our conversation, she had told me some of her other ailments was her knees and stuff. So you have to understand when I say professionalism in healthcare. I mean, I could talk to you about her because you don't know her name, her face, or where she's coming from. But I still have to have that code of ethics aside to you and to her. And it's, you have to picture this. She's a 65-year-old woman. She's told me straight out she's uncomfortable with people touching her. And I had to tell her that I had to touch you. Yeah, I mean, it's no problem for me, but it's more about her. But there's that professionalism that you have to be able to get someone to respect what you're doing and vice versa. So what I want to share with you is, how do you do that? Now, I don't think I'm about to speak to a group of people that are not intelligent enough to figure it out. You know, this room is a bunch of people that say, you know what, I'm a professional. However, there are things in that professionalism that we take for granted. I'm going to take a side note and give you another example. Because I've worked in it long enough to have thousands of examples. If you figured it out, the 6 till 9 scenario, I've been doing for actually 12 years. I haven't stopped. So it's only now that I've started to slow down because I have no choice. Plus I have to study and I have to write my thesis, and it's a mess, so I have to get my act together so I can be better for my patients and my clients. So here's a scenario that I don't have an answer for. Maybe you can help me. I'm training this young woman, and her husband and her are both inside of the gym. One day he comes up to me, he goes, "Hey Ian, how you doing?" I said, "Good." He said, "So how did it go with training with my wife today?"
Oh no.
I said, "I didn't train your wife today." Okay, so we are all intelligent, we figured it out. Help me out. I made a mistake, or did I not make a mistake?
Honest.
You were honest. It's
Okay.
she was dishonest by saying that she was training with
Okay,
you.
I have a professional code of ethic of confidentiality. I don't have the answer, I'm not kidding.
Well, you don't know what
Yes.
she was actually doing. You just know that she's...
No, but you're saying that you can't divulge who you were working with.
That's what I'm saying. And I shouldn't have.
Even between husband and
Yeah. Are you kidding?
wife. You're the worst.
Was too much in a way?
I'm sorry?
Even saying that you didn't see if it was too much in a way?
Yeah, I don't, excuse me, I don't have the answer. I'm telling you, you guys think I'm kidding. I do not, I still to this day, now this happened about 6 years ago.
Where did the competition go?
Well,
Like,
because he caught me, he set me up. But I was
Oh,
lied
he knew what he was doing?
He probably did.
in
Okay.
his head.
In his head, he figured it out, or he suspected. I don't think I did anything wrong.
No.
You understand? I don't put it as a burden on me today. But you see how this professionalism title in healthcare can get us all off a little bit?
And this was training in a gym or to see
This
her?
was in the gym. It was in the
And you don't make the difference between training in, I mean, it's all about
Yeah.
health, but training in a gym and seeing somebody as a doctor or as an osteopath?
Well, I also rehabilitate. So, like, when I'm in the gym, it's not all about training for me at this level, at this game. And back then, I was crossing the road of rehabilitation. So I'm doing a lot of rehabilitation as opposed to just basic training.
Yeah.
So it snuck up on me.
Yeah, but they both knew you, they both knew they were
Right.
training, I don't,
But I don't, you're right.
but if I'm gonna give an answer, because you're posing
Yes.
this great dilemma that I
Yes.
live with also on a regular basis, I think you did absolutely nothing wrong. I think there's
And I
a
agree
point
with you.
where, I think there's a point where there's some, I mean, you don't have to call somebody up, hey, I just, you know, you don't call somebody up to tell them, I just train, or I know who you are, or you brag
Right.
about, you don't give names, you don't give information.
Correct.
But you all know each other, and
I know it's a little messy, but you know, I have this strong code of ethics in my head that I'm rigid, I'm loyal,
Yeah.
because even husbands and wives, and you're asking a really valid question. Now watch this, sometimes they come in together. So I'm in the treatment room, and I'm treating someone, and then all of a sudden I get up and I close the door. So the husband will say, well, what are you doing? And I'm saying, well, I am having a session with your wife. He says, oh, it's okay. And then I have to go and sit with his wife. Is it okay? And she's there with my door half closed going, no. So then I'll close the door behind him, and they'll say, if you don't mind, behind me, and the wife would be in the room, I'll say, if you don't mind, just let me have a few minutes with her. So I had to figure all this out by trial and error. This is not something that was written in any book. And I'm in school still, and I'm still in the field, and I have a huge code. As an osteopath, we have a huge code of ethics. And it's really tough to distinguish some of this stuff some of the times. So, I mean, I gave you a couple of examples. I can keep going all day because I've lived, and I'm sure you've probably lived a few of those crazy ones yourself. But what I'm trying to tell you is the book that I'm speaking about and the one I'm speaking from, no one writes it. You actually write it. And it's very hard for me to sit here and say, okay, professionalism in health is the following. No. The professionalism in health is you. The way you were raised, the principles that you stand by. You make them. So I think people are understanding healthcare is our hospital system. Now I don't want to get into that. You don't want to get me started because I'm an osteopath, and that's a whole different conversation because we believe in health and wellness. And like I told the medical doctor that I treated today, now here comes a great irony. She comes to see me, and this is an emergency doctor, I love this, and she doesn't believe in osteopathy. And I go, how does that work? I've treated you at least 6 times. She came in for ocular motor response. Every time she works overnight and she gets a flutter, and I treat her ocular motor. The first time I treated her, I worked in the posterior cranial. She had no idea what I was doing. I never touched her eyes. She got up and she said, okay, what'd you do? No. I said, what do you mean what I did? I said, it doesn't matter. How are your eyes? Blink, look to the right, look to the left, looked up and down, and she walked out. She couldn't believe it. So now she's my patient. But today, when I treated her, she said to me, because she also refers me patients, she said, can you tell me how my other patients are doing? You see, I deal with this every single day. And for those of you who don't know, medical doctors sit on the top of the totem pole. I don't want to get into this really, I don't, because I'm going to hate myself. And she said that to me, and I said, I'll write my report and I'll email it to you. I said, Ian, what are you doing? I said, I am not going to tell you in this context, because you are my patient and you're on my table. End of story. She was livid. She stormed out of my office today. I couldn't believe it. I didn't have time to call her back and so on and so forth, but this is how the game works. So, is this about a code that is established in the industry, or is it about your personal professionalism and your idea of what it means and what it stands for? Yes.
I think it's more the way to say. Maybe you were too straight and she felt that she was disrespected.
Mm-hmm. So you think I could have been softer? I like that. Let's try your scenario. I'm sorry, I cannot tell you.
No touch. No touch.
You know, some people when they, let's say, refuse slam the door, well, virtually,
Right.
on somebody, they have a way to buffer you up with compliments
Mhm.
and leave you happy behind that
So
door.
smooth it over.
Yeah.
A little bit of.
I don't know how they
Topping.
do it, but I know people, some people are like,
Okay. So I'm going to repeat exactly what so she wanted to know how her clients or patients were doing because she referred them to me.
you could say that maybe, oh,
Well,
I'm
no,
glad that you
I'm
are
actually going to give you the
concerned
answer. I'm going to give you the answer.
about your patient, and that's
I'm going to give you the
great.
answer. I actually need consent from those patients who are not my patients before I can tell her. Because if I do it any other way, between us, it's a casual conversation, and that's not allowed. Ah,
No, but
there we go. No, you cannot.
no,
You're
no, no.
negotiating. It's not
No, no,
negotiable.
no. What I just said
Yes.
has nothing to do with the other patient. I'm just complimenting her.
You cannot. Because you're trying to cover code it, and I'm going to help you with this. You cannot. It doesn't matter how it comes out. You could be aggressive, you could be nice. The bottom line is, I need consent from that patient to give it back to her. There's no negotiation.
No, but if I'm talking to you,
Mhm.
I'm saying, oh, you have great hair,
Mhm.
for example.
Mhm.
I don't need consent from her, who's your patient.
I'm not sure we're talking the same language.
Suppose that I'm talking to that doctor. Well,
Yes.
I'm not experienced like you, so maybe what I'm
No,
saying
it's
is
relevant.
the same.
We're okay. We're
So
okay.
if she asks me this question, I will say, oh, I'm glad that you are concerned about your patient. That's
Mhm.
great, and I like it, and I hope that more doctors are concerned, I just cannot say
They're
it
running
right
for
now.
politics.
But don't go straight for the kill, you know.
Yeah. I agree with you to some degree, and sometimes, you know what, tact can go a long way. I agree with you. I'm not disputing it. However, you probably don't know the character of this doctor.
Or you.
Right, or me. I don't play. And this is where we have to understand where that professionalism and that professional line crosses. And that's what I'm trying to explain to you. It's a tough line to cross. There comes the day, there's no negotiation, you have to stand by it. Because she's asking me a question directly. She's saying, how are my patients doing? And I'm saying to her, well, they're doing okay. And then she says, what does that mean? We talk a professional talk amongst us. There's no fluff. I'm telling you, no, I did not get consent from those patients, but I will ask them if you like. And every report that I send a medical doctor, I have to send it to that patient, and I say to them, with your consent, I am going to,
5 minutes, yeah.
done.
No,
With your consent, I'm going to forward it to your healthcare practitioner. I'm going to stop there so I can summarize. We can talk about this all day because every situation is so particular and so different. I have thousands of them. All day, I tell you, from since this morning started. And I have probably about 12 to 15 patients a day. So when I tell you that I see this, you always have to keep that professionalism thought in your head. In the healthcare field, there is no choice because it's only going to take once. And I've made bigger mistakes than the softer ones I gave you, especially in writing, especially in the reports, because I have to write reports and forward them. That's where things get a little crazy, because people can read into things very differently. And especially in the medical field, where I'm explaining something osteopathically, where the medical world, for example, do not understand or accept my medical term when I'm saying that you have a vertebra that is turned to the right and I'm going to adjust it and put it back, and medical term is going, no, that's irrelevant to whatever. And I'm going, well, ask my patient how they did. Anyhow, summarizing, it's this. Professionalism is not necessarily a title, or it is not something that's coined that says this is what you have to do to be a professional. What I'd like to say to you, after 12 years of being in the world where I had to be professional, it requires a lot of logic and common sense on your behalf and a lot of your own ethics. Forget the code of ethics that's written, your own personal ethics and how you were raised. Question?
Mr. Parris, when you mentioned before about when the person said, "How my wife do today?" the answer lies in the fact, I believe Ann hit it, on the global, did nothing wrong. Specifically, you had two ways to go. One of them was non-professional. You might have figured maybe there's a conspiracy here, so I'll just say she did fine. Very global. Well, now you're part of the conspiracy.
So then I've lied.
Yeah.
Then you lie. Now, the other thing is, therefore not professional. The professional thing is to say, I didn't treat your wife today, you guys deal with whatever goes on. I didn't treat your wife today. Hey, she might have been out buying apples, she might be in Rome. The point being, it's not your call. You didn't.
But she might have been buying him a gift, for example.
Exactly.
Right.
So there you go.
That's the
she
best
had a
scenario.
surprise for him one way or another. And it's not your call to say she did fun.
Great.
Just for fun.
Thank you. Thank you all.